Hi everybody, I'm Dr. Libby at Implant Center of Miami, and I just wanted to go over with you what a surgical guide is. So this is the latest and greatest thing that we've been doing here. It is a total game changer when it comes to implant placement. So basically what it is this. It's a piece of plastic with holes in it for the implants. And it's what we use most of the time during an implant placement, unless it's a super easy, super simple implant with tons of bone. We will make a surgical guide if we have two implants in front of each other, next to each other, or an implant in the front where we want a little extra help getting the implant perfectly centered in the bone and also in the perfect placement so that we have a good looking crown later on. So what we do is we take a digital scan of inside the mouth, and we also take a CT scan of the bone. We lay the intraoral scan over the CT scan, and we come up with, number one, something called a digital wax up, which is a model of where we want the teeth to end up later. And then we use that as a guide to where we want the implant to be placed inside the bone above it. And that's what this represents. These holes are not just holes randomly placed where we think the teeth should go. The digital scan and the CT scan were both used so that the angles of these holes and the positions of these holes are perfectly centered in the bone and perfectly centered in the middle of the crown. So another advantage for the patient, aside from having really great looking crowns later on, is also that it minimizes the trauma during the surgery. It quickens the surgery so the patient thinks like, what, you're already done? And also a lot of the times we don't even have to make a cut in the gum. We just go straight through the gum, through these holes, and the patient virtually has no pain after the surgery. On a personal note, I just placed an implant on my father last week using one of these surgical guides and followed up with him for several days afterwards, and he had minimal to no pain afterwards, a tiny bit of soreness the next day as to be expected, but we didn't have to open up his gum, there was no cutting, there was no suturing. So it really is a total game changer for the patient and for just the whole surgical experience in general, and then later on also for having really nice fitting crowns perfectly centered on top of the implants. This is the kit that we use. It's just a series of drills that, it's foolproof. It shows us, if you're placing this size implant, you just go along this line. That's really on our end. It's not something the patient needs to fully understand, but we also have these guides printed out that basically is just a reminder for us to show us exactly where we want these implants placed. So on this patient, we have two implants on the upper right side, and then these are the implants that will go in, and it shows me exactly where they'll end up in the bone from different angles, and the implant sizes that I'm going to need to prepare in advance to make sure we have. So it really just makes the whole process super easy for us, super easy for the patient, and a really good result in the end. Hope you enjoyed this little bit, and I hope that you enjoy the easier process of getting an implant, and it makes it such a less traumatic experience for everybody.